Thank you, Presiding Officer. It's one of the great achievements of the Labour Party that the National Health Service was brought into being in 1948, but we should not forget the genesis of that achievement. It started with the Lloyd George Act of 1911 for national insurance, and indeed to this day the folders in which one's medical records are held are still referred to as a Lloyd George. And I've heard that actually said in a doctor's surgery within the last 12 months. There are very few politicians who get the name in that way in history. We've got another one just a few hundred metres from here. We have a Belisha Beacon. Howard Belisha was a Transport Minister in the 1930s. And I commend to Grampian Health Board that perhaps the hospital yet to be named might be L'Hôpital Alar, thus immortalising my colleague to my left. But perhaps most important is the Highlands and Islands Medical Services Grant Act of 1913, which actually for 35 years was in essence a National Health Service centrally funded and managed, free at the point of delivery for the Highlands and Islands. It, for example, put the first resident nurse on St Kilda in 1914. So Scotland has actually led the way in which we now deliver free to people who need it, health services today. So let's hope that we can maintain the consensus that says that that's what we should do. And of course, we should also remember that William Beveridge, whose report in 1942, the report I have the name, oh yes, the Social Insurance and Allied Services report, was a Liberal. I will, yes, briefly, please.
Dennis Roberts.
Very brief, Mr Stevenson. In moving to the 21st century, Mr Stevenson, would you acknowledge that telehealth medicine is the way for the future in a lot of our remote and rural areas?
Stewart Stevenson.
The member is absolutely right, and of course our geography means that we have the opportunity to innovate and the greatest benefit to deliver. And it's worth remembering that the first medical air service started in 1935 in Scotland, and the first patient travelled from Islay to Glasgow on an ad hoc basis in 1933. Now, for me, of course, the really interesting things, since I worked in the health service 51 years ago, where the staffing and the resources was so substantially less than it now is of course the 36.2% increase in geriatric consultants since September 2006 up to September 2014. That I particularly welcome because, as you can work out, if I was working as a nurse 51 years ago, that's a matter of considerable personal interest to me. And associated with that, of course, the nearly 30% reduction in senior managers in the health service, diverting resources to where it's needed, which is in the front line. And I think that's a process which has been going on for some considerable time. We've all got our hands on that, but we must make sure as parliamentarians that we continue to hold our ministers to account to ensure that continues. Now, things have changed. My father was a GP, single-handed, rural and urban, and as a single-handed GP he had 2,200 patients. Nowadays it would be inconceivable that a GP could have that number of patients because, of course, what GPs and people in the front line now do is so much greater. 50 years ago, what the GP did was very important, but it was much more about pastoral care. There was less medical intervention than we would nowadays expect. Now, we've had a lot of changes over the years. We've seen a huge focus on workplace health. We've seen a reduction in accidents in workplaces, work-related disease. We know the phrase, mad as a hatter. Well, that came from the use of mercury in the industry that made hats. People who made hats became mad from exposure to mercury. That doesn't happen anymore. And the next challenge for us all is, of course, the personal responsibility that was mentioned by Jackson Carlaw. Health warning in the Herald a week ago, lack of exercise twice as deadly as obesity. From Public Health Wales, a report, higher cot death risk among families who have smokers in them, an element of personal responsibility. Now, we get lots of messages through the media. I particularly liked The Independent on the 19th of April last year. A bottle of wine a day is not bad for you, and abstaining is worse than drinking, scientist claims. Now, I suspect that's a bit over the top in terms of the claim, but the point is we're all exposed to these messages, and I think we in public life have to take some responsibility for making sure that people get sensible messages. Now, in conclusion, Presiding Officer, let me just touch on the issue that is raised by the Labour amendment in relation to staff. And of course, the 2014 NHS staff survey shows that 26 out of 29 core questions we've seen an improvement. And in particular, 90% of staff said they were happy to go the extra mile at work when required. That's an increase of 3% since the previous survey. At the core of our health service is our staff. Let's continue to support them and congratulate them for what is a world-beating service at a world-beating price. Presiding Officer.